The following presentation is a production of Ride the Wave Media.
It's the Best Birth Podcast, where we interview experts that elevate you as you prepare your heart and mind to have the best birth.
Each episode will interview professionals so you are prepared for pregnancy, birth, and postpartum. Our experts will build your confidence and empower you to trust your intuition throughout your pregnancy.
This audio is taken from videos on YouTube. Watch the entire episodes on YouTube at Birth Made Mindful. Welcome to the Best Birth Podcast. We are here to help moms and dads and everyone in between prepare to have the best birth. Our first guest on this episode is HeHe, the founder of Tranquility by HeHe and the Birth Lounge. We're so excited for today's conversation and want to welcome HeHe to the show.
Thank you for being here, HeHe.
Thank you.
HeHe has, it was so good. HeHe has a master's degree in human development and family studies and 10 years in the family life education field. HeHe helps women prepare for childbirth with research-backed education and expert support to have a confident birth experience while feeling informed and in control of labor without fear or coercion. She is a pro with preparing for postpartum, helping you master feeding your tiny human, and understanding newborn sleep. She and her team serve pregnant people and their families across the U.S. and internationally with prenatal birth and postpartum care. She hosts the Birth Lounge podcast, which has over 150,000 listeners in over 28 countries. The show features leading experts in pregnancy, women's health, and childhood development so parents can understand how to have an informed and confident birth. Welcome, HeHe. We are so excited to talk to you.
Hey, thanks for having me, you guys. This is so fun.
We are absolutely thrilled that you're joining our show today. And we want to first kind of just ask, how did you get into this space of being the birth cheerleader and champion?
I love that. I absolutely am your cheerleader when it's time for you to have a baby. So, my career started out in early childhood education. Before that, I did advocacy work within the public school system. So I came to doula work, actually not really expecting it to be a career change, but I thought I might attend births here and there. I took a weekend training and I realized that A, this was for me, and B, the weekend training just didn't suffice. It was kind of shallow, and I felt like, wow, I have this master's degree in human development and family studies. I have worked in advocacy work and helping parents navigate a system. It was a school system, not the hospital system, but a system. And I also had that really deep knowledge of infant development, family dynamics, the family unit. And I thought, OMG, what if I could combine all of these things and create this concierge practice where parents, it's a one-stop shop. And gosh, that just got the ball rolling because then I started to find out about all of the injustices and abuse that happens in the hospital. I started to learn more about horizontal workplace violence in the hospital system and how that impacts patient care and outcomes. I started to learn about obstetrical violence from physician and nurses down to patients. There was so much to unpack there. Hospital policies, legislation, politics of the hospital system. And I just was like, holy cow, this is so much. I think this is my calling. And so here we are. That was 8 years ago now. And it truly has been a calling. And I wake up every single day jazzed out of my mind to be able to do this work. And that doesn't mean I don't have hard days. Some days really suck. You see kind of terrible things in the hospital sometimes, and people can be really nasty in the birth space. But it does mean that even though you have hard days, I know that it's worth it because of the stories that women come and tell me about how much our resources help change their birth and truly give them back control in a system that was kind of designed to take that control away from women.
Well, and thank you for following your calling. Your work really has transformed the conversations that people are having about their options and how they can have the best birth.
Yeah.
So I want to know, just kind of from the start, what would you say is the number one thing that a woman can do as she is preparing her body and as she's pregnant so that she has a really good birth?
Yeah, so specifically physical preparation. Cool. So I think two things come to mind. Understanding that your brain, your mind will give out way quicker than your body in labor is huge, right? So your body was designed for this. That doesn't mean that we don't ever need medical intervention or that your body, all bodies everywhere, always will have a perfect baby. That's not what that means. That means that for the most part, women's bodies are designed to give birth. And so for a lot of births, it's just a natural event that sometimes needs some medical intervention. In the Western world, in the US, we see us treat it more like a medical event that sometimes happens naturally. And that's really backwards. And we can see that play out in the stats. So, understanding to prep your mind, you should be prepping for 1 minute increments. You should be prepping your body for 1 minute, 60 seconds, and 90-second increments, doing physical exercise during pregnancy as well. So, look up what ACOG recommends for physical exercise compared to what you're currently doing, and then get on a plan either before or when you get pregnant to physically prep for the endurance piece, right? Um, okay, and then, well, those are the two things. So, physically prepare your mind to understand I can outlast my body, right? My body is meant for this, and then you want to be preparing that body piece for those contractions. And then now that I'm saying this, I have a third thing too. You want to be practicing grounding yourself. So, a lot of times, labor can bring on tension. It can be mental, but we just talked about kind of diving into that. And these are all very shallow, guys. There's so many layers to preparing for a baby, but these are just kind of the things that instantly dumped into my head.
Let's jump into these interventions a little bit. How can we use interventions to support us rather than just the black and white answer of the standard?
Sure. So, we want to look at the benefits of routine care. In a lot of cases, it's not beneficial for every person. And so when it comes to routine standardized care, you really want to think about, is it individualized to me? So you may have preferences around IVs, right? You may want to go in, you have an intense fear of needles. You do not believe that the benefits of having a preemptively placed IV outweigh the risk or that you may encounter. They don't outweigh the anxiety. They don't outweigh the pain and discomfort. They don't outweigh the disruptions to your labor that all of that may cause you. And so you're choosing to have no IV. On the opposite end of that spectrum, someone may choose to utilize that because the fear of that risk of possibly experiencing a postpartum hemorrhage and then kind of on that time clock, that is an emergency. So we want to get things done fast. That may outweigh the risks for them. And so for them, getting that IV is the right choice. You want to think about this in every single thing. When it comes to birth choices, very few times does it boil down to right and wrong. And very few times is it black and white like that and just very uber clear. For the most part, it is, here are the different options. With each of those options, here's what you're going to gain. Here's your benefits. Here's what we might be risking. And then also, if you don't like that, here's an alternative. And then you want to think, where on that spectrum do I fall? So let's talk about epidurals really quick. Utilizing them. If you know you really kind of have a preference for unmedicated birth, but you're open to an epidural if you get to a place where you need it. What we teach in Tranquility by HeHe and inside the birth lounge is that just knowing that you're open to it is not enough. You need to have clearly defined boundaries about what is a situation that you would be okay with it. I am okay with discussing an epidural if I've labored for 4 days and not made any progress. I'm in prodromal labor. It comes, it goes, it stops. It is agonizing and I can't get any sleep and it's disrupting our home. I'm open to that. I'm open to an epidural if my blood pressure gets to a certain point and me and my baby we're in danger. That's another way that you can utilize it. I am open to an epidural if I begin to be fearful of my contractions and it's preventing me from being able to relax and release. And therefore, we're running into a problem that may present as a stalled labor or some sort of like swollen cervix, or just you're dilating, but very, very, very slowly. And you check in with yourself and go, you know what? I'm actually pretty scared of active labor. I think I'm too freaked out to relax. I think I might need an epidural. And then you make that decision. From there, we should be having conversations with your anesthesiologist about what your expectations for your epidural is, right? So I would still like to have a lot of mobility. So I'm really hoping to have a very specific placement that isn't going to numb me up too much. And I would like to start at a really low dose. I understand you can add boluses. That would be like 1 shot of medication. And I also understand I have my PCA, a patient controlled administration button. And so it comes in this little handle. It almost looks like a Jeopardy button. And you can press the button and you can self-administer medication through your epidural. A lot of people do not know this. On the flip side of that, we can numb ourselves up way too much to be able to feel where our baby is. It might stall labor. It might create a really long period of pushing. But gosh, I rambled there, but I feel like that was a really good example of how you can utilize these tools in different scenarios. But knowing you're open to an epidural is not enough. You have to know when and how to utilize them, and you have to know where you fall on the spectrum of each, or the system will literally gobble you up. And that's the truth.
And if I think about all of these interventions like an all-you-can-eat buffet, right? Do I want to go down that line and take every single one of them? Or do I want to utilize what works for me? And just like you said, according to my values and how I'm performing, how my baby is handling the contractions or handling the Pitocin. And so it's amazing to hear from you all of this education that can really empower us as birthing women to make the right choices in the right moment.
It came to me, your third point, it was being grounded. And
That is right.
Right. And so that just goes right along with what we were talking about is once you are grounded, you do know your desires, you do know your intuition. And how can you get back to that grounded space in those moments?
Okay, so here was my point on that is as women, we typically hold a lot of, if you are kind of like an anxious lady, and you have a lot of tension, I fall in that category, so I'm kind of talking about myself. We probably women tend to hold a lot of their anxiety in their pelvic floor, right? In your hips, in your lower back, in your uterus. We want to be able to relax our body and trust in the process. Social media has this really, really nasty way of not only polarizing birth, but really highlighting the terrible, awful, horrible things that happen. Social media does that about every topic, but in particular, in birth, it's very sinister because it really does set women up for being really fearful of birth and not trusting their bodies and believing that birth always goes badly, not recognizing that most of the time, if left alone, birth will do its thing. And it will work out good, positively, for the most part, if left alone. So yes, being grounded, super important. That's not going to come natural to a lot of people. So you have to practice it. It kind of goes back to that first point of mindfulness. You have to be able to shut your body off, shut your mind off so that your body can take over. And that really means being safe with the people that are in your room, being safe with your partner, knowing that they're going to take care of you and they're going to protect you, being safe in the thoughts and the education and the confidence and the information that you have inside yourself so that you can truly navigate these conversations. That safety in your birth space is a lot under your control. Sometimes there are factors that we can't control, but in many cases, we could always swap those out. So if you have a provider that doesn't make you feel safe, they're bullying you, they are dismissing you, they are waving in your face the number of years that they've been a physician, that is not safe behavior. That is not behavior that tells me, hey, this provider trusts this woman. This provider trusts the birth process. This provider is going to trust that everything is going well until this body or this baby tells us that we should intervene. And then in that case, I trust them to know how to respond. We don't need to react to everything. We should, in birth, a lot of times just wait and respond to what is happening. A lot of times, and I talk about this a lot when I talk with birth injury lawyers, is the things that we preemptively intervene on in birth most often lead to the bad outcomes and therefore increases chances of litigation, which is such a big driver of preventing these things, right? In the OB world, we hear a lot of, well, we're going to do this so that we can prevent this. But when we do that and we preemptively intervene and things go sideways, that's where we see a lot of birth trauma arise. And we could have avoided all that birth trauma had we not preemptively intervened.
Well, and this idea of waiting and responding, I can see why this would be so difficult in our day because everything needs to happen now. I want my fast food through that window in 2 minutes, and I want my baby to be born in 2 hours. So tell us, how can we take control over this feeling? How much time is this going to take? And why is everybody rushing me? And why isn't my body doing this faster?
Yeah. Well, let me just set the stage for you. An average first-time birth should really be expected to be between 24 and 36 hours. Like, we're talking kind of a long time. That's not all active labor. People typically think like, oh my God, 24 hours of like, oh, I can't do this. This hurts so bad. It's not. It's not. You're looking at 6, 8, 12, 16, even 18 hours of very manageable labor. You're talking a few hours of really active labor. It could be a little longer. And the good thing about unmedicated, undisturbed birth is that your most intense part is usually the shortest. It's usually the quickest part of labor. It is going to be intense, but this goes back to kind of preparing beforehand of what to expect, trusting your body, knowing how to relax into those sensations. So being rushed in the hospital, your waters are broken, and Pitocin. We should talk about all of those in terms of time too, because they're very important for people to realize. Once you go into the hospital, you're on a time clock. Once your water breaks, you're on a time clock. So let's circle back to that. 40 weeks. Oh, it's an estimate, okay? First of all, if you're not strictly tracking your cycles and you don't know exactly when you conceived, that's a guess as well. We don't know exactly when you conceived unless you are tracking your cycle. You must think too that when you get a positive pregnancy test, you are 2 weeks pregnant. Yet in the world, we say, in 1 month. No, you're not. So when you get to 40 weeks, your baby is 38 weeks gestation. That is the earliest they need to be born, yet we back our calendar up to 38 weeks, and those babies are 36 weeks. And we wonder why a lot of babies that are induced need a NICU stay. It makes sense. It makes sense, right? Like, and I do my hands like this because I just feel like I've beaten a dead horse, and then I hop on conversations like this, and I'm like, I forget that not everybody can see the correlation there, and not necessarily correlation, but possible causation. When we see an increase in induction, we see an increase in NICU stays. 40 weeks too can be thrown around in terms of placental health. So, well, your placenta might give out. That is true. Yes, placentas sometimes do stop working at the end of pregnancy for sure. Couple things to know. A, your placenta cannot see a calendar, so they have no idea that you're 40 weeks. B, there are typically other signs. And C, you can check for these things. When you have your ultrasound and your biophysical profile called BPP, you can have your doctor check for these different things. You can ask for a check-in on your placental health, and that will give you really good insight into whether your placenta is holding up at the end of pregnancy. Remember, your placenta, your baby, they grew together and they know each other, and they're a system. They are a pair. They're the yin and the yang, right? If your placenta starts to deteriorate or not give your baby the things that it needs, your baby will let us know. They will stop growing. They will not look great on our BPPs and our ultrasounds. They will slow down or get really erratic in their movements. If you're not familiar with counting kicks, let me enlighten you. It is an app that can prevent stillbirth. Any change in your baby, really a lot of movement, like really erratic, chaotic. Whoa, where's that? This baby's gone crazy. All the way to like, I actually should be feeling my baby about this time. Where are they? Any big deviation from what their normal is, we need to be calling your provider, and you should not be taking any sort of outdated information like, well, drink some juice or cold water or just try and jiggle them up or take a little nap, lay down and see if that helps. We really want to be checking in on your baby because those deviations could be messages from your baby saying, hey, I need a little help in here. My gas can, the placenta, is starting to run low. And so a BPP and an ultrasound would be what you would request from your provider.
I love that. And I always think about it, 40 weeks, it should not be our finish line. It should really be our starting line.
Totally. Well, you also have to recognize that ACOG does say that there are pregnancies that go beyond that 42 weeks. And so while 42 weeks is, and it used to be a very normal, like 30 to 42 weeks, you'd have a baby. Now it's like, oh my God, you're 42 weeks. Oh my God, I can't even believe it. A lot of pregnancy would probably go into that 41st, 42nd week if we let them, if we were hands off, if we kind of, did that responding versus really trying to control things. But I believe that if it was super unsafe, or I guess that's it. If it was super unsafe, ACOG would not say that that was a safe alternative. They recognize that pregnancies go that long, and they do have protocols for how to manage those pregnancies. And counseling your patient and being counseled by your doctor is a normal part of that process. You do want to be having conversations. But a lot of people come to me and say, I'm pushing that 42-week mark, and I actually think it is because I think my baby's not here is because I think my due date was wrong. I actually think my baby is only X amount of weeks. And so you can have that conversation with your doctor. There are guidelines around your provider changing your due date. So just know that sometimes they will come back and say, like, unfortunately, I can't change it, or, I'm not going to change that. If that's okay. In your head, if you know it, let that influence your decision as much or as little as feels aligned to you.
And you were talking about like timing for labor. Can we get into a little bit about this first-time mom whose labor might last from 24 to 36 hours and how we can really get ourselves in a place that we can accept that?
I mean, guys, that's normal. I guess, like, why wouldn't we accept that? What's the holdup in accepting that? That instant gratification, I don't say this to scare you. I say it to put it in perspective of, like, you could choose the 24 to 36 hour route and come away with, none to minimal birth trauma, or you can choose to speed things up and unnecessarily intervene. And we know the likelihood of your birth trauma is going to significantly increase. I don't think that inductions are a bad thing. I think that they're overused. And a lot of people will say they're overutilized. That's not, if you overuse them, that's not utilizing them. Utilizing them is using them to the best that we can, using them enough to improve results without hurting our results, without harming people in the process, without causing additional C-sections or NICU rates, right? So yeah, that's it.
Well, how can women determine their goals for labor or birth when they're unsure or uneducated about what is going to happen? What's a good plan to go about your birth goals?
It's never too late to put together a birth plan. In terms of birth planning, though, we must recognize we cannot plan out birth, but we can plan for different situations and scenarios that might pop up in labor. And I call these twists and turns or birth pivots, where your birth, don't forget it's a natural event. So nature, outside of our control, does have a large influence on birth. And so we want to leave room for Mother Nature to do her work. Sometimes we're hoping that contractions start, we get to labor at home, and everything is groovy. We go into the hospital at 8.5 centimeters, get into a labor and delivery room, have a baby an hour later. It's blissful. And then what really happens is you go to bed one night and your term, so it's not preterm, but your waters break all over the place. And you're like, okay, now what, right? This is a pivot. You still are in total control, but what you're not in control if you're not prepared. So if you've never thought about this scenario, you are going to spiral and be like, oh my God, this wasn't part of the plan. We were supposed to I was supposed to have contractions first, and I was supposed to be able to be here in my waters. I never even thought about when my waters would break. We want to think about, okay, what are you going to do at this point? Well, your GBS status may matter to you. There is an approach where you get antibiotics throughout labor in order to combat that GBS. And then some people choose not to have those and to do a wait and see approach where you monitor yourself and your baby postpartum to see if either one of you need antibiotics. That was a very shallow. There is much more to those protocols. So don't just hear this one time and think that's everything, but look into it. You have options. People have different feelings about stuff. So what will you do at that point? If let's say you're GBS negative, there's no meconium, your water smells like amniotic fluid. It's a normal amount. Your baby's moving as normal. You don't have a fever. You feel great. No contractions are here. Your options would be to go to the hospital if you wanted to, go back to bed if you wanted to, or try and encourage labor at home. Try and get things stimulated. You're free to do any of those. They're all going to have different outcomes. If you go to the hospital's going to want to try and do something. That's their job. They want to try and get things going. So likely that's going to be Pitocin after your waters have broken. You could have a conversation about cervical ripeners. There are guidelines about using cervical ripeners once your waters have broken. So make sure that you're having this conversation. But likely your option is going to be Pitocin or to go to the hospital and hang out and do nothing. But you may run into the problem where they don't want to admit you because their job is to get things going, right? If you decide to go to bed and put down something on your bed and go to sleep, likely contractions will follow at some point. You may wake up in the morning and still not be in labor, but that next day they may come, or that next evening. There's different guidelines and approaches and beliefs around how long your waters can be broken. Hospitals typically would like to see your baby be born around 24 hours of your waters broken. In terms of true infection risk, the data suggests more around 48, possibly even 72 hours, depending on how we've been treating your body in that time. And what I mean by that is, if you get into a bathtub, have you cleaned it out first? Remember, your amniotic sac is open. Don't be having penetrative sex. Fingers shouldn't be up there, not sexually, but cervical exams. We want to really minimize and think about cervical exams once your waters are open. Once your waters are open, your baby is exposed to the outside world in a sense. So is your amniotic fluid in both layers of your amniotic sac. There's 2 layers to the amniotic sac, by the way, is a chorion and amnion. So if you didn't know that, you can get an infection in any of those places, in either of those layers and in your amniotic sac. So yeah, what was the third option? Was to try and get labor going. If you try and get labor going, one of the possibilities is that labor gets going. You sit on the birth ball, you put it in the tub, you start hand pumping your nipple stem, and labor is going. The other option is we don't get labor going and you kind of exhaust yourself. You have option of combining those things. Maybe you decide to go to sleep because it's 11:30. You are going to give yourself until noon tomorrow. And if labor has not started on its own, then you are going to start encouraging things at home. You're going to lay in the mile circuit. Once you pick up your toddler from school, you're going to go curb walking. You're going to clean out your tub and get in the tub during bath time or during dinner time and let your partner do the evening routine so that you can hang out and just relax. And then maybe you give yourself until 24, 36, 48 hours. And if labor hasn't started then you're going to utilize the hospital option. You can see how it's a spectrum and you can use different options along each spectrum in the specific order that you want. It's almost like an equation. It's like an ingredients list. You put together your specific recipe of the birth that you desire, and how much of each thing that you want. Do you want a really medically involved pregnancy? Some people really, that makes them feel super comfortable. There's a way to do that. And then some people want absolutely nothing. If they can get away with no cervical exams, no IV, not even maybe going to the hospital, maybe they're home birthing, that's their ideal, right? You got to find your flavor.
And I love that you're talking about these ingredients because the more that we know about the ingredients that can be added, the more beautiful we can make our end result.
Yeah, absolutely. It's as individual as your fingerprint.
And then what happens if you planned for a certain birth? Maybe you want a VBAC, or maybe you had planned for your first vaginal birth and then it's a C-section. How do we work through the mental components there if we were attached to one outcome or the other?
Yeah. This is deep. So, birth trauma rarely looks like physical injury. It just doesn't. A lot of birth trauma is mental and emotional. And so I know, right? Like, it's deep. It hurts our heart. It hurts our soul. It hurts our confidence. It hurts like us as a human. It just hurts, right? Birth trauma is very painful. And being attached to a certain outcome, I think, can sometimes exacerbate that. I think instead of attaching your happiness or your outlook of your birth on a specific outcome, I try and instead instill in you a confidence that says, no matter what happens in my birth, I know I'm going to stay in control. And I know that I will figure it out. Everything is figure outable. And I truly do believe that in birth. I think that a lot of times that can be fairly difficult to achieve in the hospital system because the system is not set up like that. But if you either get really lucky with who's on call when you go into labor, or you do the work to find a provider that's going to come to your birth after they have given you your prenatal care and you're not being seen by kind of a Rolodex of providers, or you've done the work to seek out a home birth midwife that you feel really confident in, and they're going to be the ones that are at your birth. I think you can have that, but sometimes it's hard to get it in the hospital system. So just think about that. And again, these things are not said to scare you. It is to say, here's what you can expect in the hospital system. Take the 9 months that you're pregnant, or the 10 months, and do the work to protect yourself against it. Like if you knew a flood was coming, are you just hanging out in your living room watching TV? No, you're not. You are getting a higher ground. You're packing your stuff up in waterproof bags. You're getting sandbags. Prepare for birth. We have the time to do it. Excuse me. It's really, really important that we take the time to prepare the right way. And, your nursery is really fun and your registry is really fun. And I'm not trying to take those things. I'm not a practitioner that feels like you shouldn't do those things. I think you should do them. I just think they should either be the first or the last things you do, or they're peppered in, but they should not be your focus. Your focus should be really learning, what is your goal in birth? How do you want to feel in your birth? How do you cultivate that feeling in your birth space? Where do you find a provider to support that? And then how are you actually going to advocate for yourself in the birth room to make sure your goals are met and respected?
This is incredible. It's so inspiring. And the word that comes to mind when you say, like, how do you want to feel? The word is energized. Like your passion and your fire and your education and all the knowledge that you bring to us, I think just really gives us that energy and that hope in our births. Can you tell us, do you have any resources, authors, books, like things that you love personally that we can share with our listeners today?
Oh my gosh, you bet. Oh boy. So can I share a list of books with you later for you to put in your show notes? There's a list of just like really, really awesome books for people who are trying to learn about birth, right? If you are someone who is trying to learn about the medical system and how it influences birth in America, Born in the USA is a wonderful book. And I think another book is called maybe Catching Babies. It's written by a midwife, and it's another really great book. I'll get you a list of it. Badass Mother Birther is another wonderful person to follow. She really does a great job of depicting what undisturbed birth can look like. If you want to follow me, I teach all of your traditional childbirth education stuff. So everything that you get with all other childbirth educations, positions, and paid relief and partner support and all that jazz, everything that you get, But what I do a little bit differently is I teach you the advocacy skills. So it's not only what are your goals and what are your options, but it's how do you actually get those met in the birth space. I think the documentary Why Not Home is another really powerful one. It can be kind of tricky to find online, and oftentimes it's behind a paywall. But I don't know. I'm pretty biased, but I think it's worth the money. It's really interesting to see. Oh, what the plot line is that medical professionals that work inside the hospital are choosing to birth outside of the hospital, and it's very, very interesting to see their perspectives and why they choose to birth outside of the hospital when they've dedicated their lives to working inside the hospital. It's the perspective is really wild. And then there are a couple really great OBGYNs online that are really showcasing what patient-centered care looks like. Dr. K is a high-risk MFM. Dr. Lexi Hill is another one, and Dr. Nicole Rankins. They all do awesome work. Obviously, all women, duh. And they really, again, they showcase what patient-centered care looks like, so that if you're not getting that, you know how to spot that, and then you know how to change to somebody who can give you the appropriate care that you deserve.
Oh, and the care that we deserve is exactly what you're talking about. Just having the options. What are my risks? What are my benefits? How can I eat from this all you can eat buffet, but also not feel gross at the end of dinner? So this has been such an amazing conversation, HeHe. Thank you so much for your time. Do you have anything else that you'd like to add?
Yeah, I will say if you haven't looked into home birth, you should. If you are even like a little interested, just check it out. It doesn't have to be for you, and you definitely don't have to choose it. I understand that the hospital can sometimes feel safer than home birth, but for a lot of people, home birth is just as safe. If you decide that the home is not for you, make sure you're doing the work to have a good hospital birth, because it is possible. You can definitely have a good hospital birth. They exist all the time. But those people are working hard for them. They're getting the right provider. They're doing out-of-hospital childbirth education. They're preparing their partner. They're hiring a doula. They're doing the work to get those. So I think that's where I'll leave you. Positive hospital birth can absolutely exist.
Thank you. That is awesome. I have loved this conversation. Before we go, we're going to share a Mom Squad secret. We're going to do this every week. And this is from a woman in our community, and her name is Dawn. She said, start taking prenatal vitamins a few months before you start trying to get pregnant. Always a great reminder to begin that nutrition early as you prepare to conceive.
HeHe, it has been a complete honor to interview you today. We hope that all of our listeners will also follow you at the Birth Lounge, and we thank you for your time.
Thank you very much for having me. Thanks, y'all.
Thank you. Thanks for joining us on today's episode. We hope you've been elevated and inspired by this week's expert.
Subscribe today so you never miss an episode. And please share our podcast or post on your social media so that other moms and dads-to-be can also have the best birth.
Please note that the information provided is based on the expert's insights and personal experience. It is not intended as medical guidance. Please seek the advice of your medical provider as it applies to your specific condition.